Hi, my name's Dr. Susan Plank, and I help clients go from feeling fatigued, frustrated, trying to piece their health back together, to feeling energized and like the clock has been turned back to a younger, healthier version of themselves. So if you definitely have a younger, healthier version inside of you that just wants to burst out, wants to be revealed. So let's transform your health so you feel like yourself again. Today, this YouTube, we're going to be talking about anemia of aging, anemia of the elderly. So it's a fatigue state. It is a type of anemia, and anemias affect red blood cells. They affect how much oxygen can be carried around. So we're looking at anemia that's chalked up to folks just aging, where in reality it gets a little bit deeper than that. It's folks that have had maybe some other health issues and nutritionally haven't necessarily taken care of themselves, haven't gotten, but not knowing it. They haven't gotten the nutrition they've needed, and now their body is depleted. Their bone marrow is depleted, doesn't have the vitamins, minerals, nutrients it needs, and therefore the bone marrow can't pump out and make nice, healthy, robust red blood cells. Okay, so it's this transformation that's happening that the person might not even know that it's going on, and yet it gets sort of thrown in a bucket of, oh well, you're getting older, right? You're just getting older. You need to accept it. Where in reality, it's actually a nutritional type of problem, nutritional basis to it. I always try to do the deep dive. So symptoms are going to be fatigue and weakness and pale skin, shortness of breath, maybe if you have to go up and down the steps, right? Dizziness, lightheadedness. Think of some of these symptoms: cold hands and feet. Some sound like thyroid, right? Some sound like, oh, dizziness. Well, they put me on a new medication. All things we start to chalk up to folks that are aging. And yet they can be related to an anemia, a deficiency in their body that's affecting the body's ability to produce healthy and a sufficient number of red blood cells. So, with the symptoms of this type of anemia, we typically see it start around somebody in their 60s that's still typically fairly robust energy wise, but we can actually see it hit folks in their 70s and 80s as well. So we want to just not sort of accept, oh well, I'm getting older, I just have to live with this. If it's approaching that age group or in that age group and see that your energy just isn't where it is, I would strongly recommend reach out to me. I'm a functional nutritionist. Let's look at your labs in a different way. Let's look at your labs in a different way. Those little um, normal ranges on lab work, right? They don't give us what your body needs. It's just a conglomeration of everybody's normal results thrown together. And you're probably having specific needs that you don't know that you have. So I want you eating iron rich food, B12, folic acid. We see folks that are more vegan, vegetarian, they can be deficient in B12. Lots of vitamin C rich foods, the citrus and things like that. Lean protein, especially ladies, as you age, you're dropping off in the amount of protein that you're eating. Okay. So we want to make sure we're getting the lean protein, antioxidant rich foods, lots of water. I'm a stickler with water. I want it to only be water or herbal tea. I don't want you to be adding things to the water because, in my opinion, your body can now interpret that as food. And we need to look at limiting inflammatory foods for you. So there's different testing involved with actually diagnosing anemia of the elderly, of anemia of aging. But typically it's sort of a diagnosis that's given by, like I said, somebody in that 60 to 80 range typically. But then they're just sort of stuck. And with the name of it, they're thinking, that's exactly it. I just have to live with it now. And every day of my life, I'm going to have less and less energy. So I want to thank you so much for tuning in. I hope you found this informative, and check back soon because I'll be covering other areas of fatigue that we can fix with nutrition. So don't forget, there is a healthy, energetic you trapped in that body, and you might forget what that person felt like when you were younger, but let's reveal that person again. Let's bring them back to life, and let's get you on a road to a healthy, energetic body. Take care. Thanks so much, Dr. Susan Plank. Great to see you. Bye.